before the city wakes up, before offices open, before markets become crowded, millions of women have already begun working. Preparing food, cleaning homes, raising children, caring for the elderly. Work that consumes hours, work that sustains families, work that keeps society moving. Yet for generations, this labor has remained invisible, not counted in the economy, not measured in national productivity, often not even recognized as work at all. In Ethiopia, many girls leave school early, not because they lack dreams, but because they are expected to help carry the burden at home. Domestic work is often seen as natural, as duty, as tradition. But what happens when an entire system depends on labor that no one values? Across communities, unpaid care and domestic work quietly shapes the lives of women and girls. For many, the burden begins early. Many girls never make it to secondary school. They are expected to stay home, helping their mothers with domestic responsibilities. Women spend countless hours cooking, cleaning, collecting water, caring for children, and supporting family members, often at the expense of their own education, health, leisure time, economic opportunities, and participation in public life. Yet despite its enormous contribution to families and society, unpaid domestic work remains largely absent from national economic systems and public policy conversations.
እንደሚታወቀው የዚህ የማይከፈልባቸው የቤት ውስጥ ስራዎች በአሁኑ ሰዓት እውቅና እያገኘ አጀንዳ እየሆነ መጥቷል። ቢሆንም ግን ለኢኮኖሚም ከፍተኛ አስተዋጽኦ እያደረገ ባለበት ሁኔታ እንኳን አሁንም ሪኮግናይዝድ አይደለም። አሁንም ቪዚብል ሆኖ የሚታይ ቫልዩ ዋጋ ተሰጥቶት የሚታይ እንዳልሆነ የሚታወቅ ነው።
Recognizing the growing impact of unpaid domestic work, the network of Ethiopian women's associations, NEWA, launched a national initiative titled Coupling Unpaid Care and Domestic Work with Local Development Agenda for Improved Care Systems in Ethiopia.
ኢሴማግ በዚህ ረገድ ከምታጎላው አጀንዳ አንዱ የሴቶች የማይከፈልባቸው የቤት ውስጥ ስራና የእንክብካቤ ስራዎች አንዱ ሲሆን ይህን ለሴቶች የተለያየ ሁኔታዎች ማለትም የሴቶችን ጤና፣ ትምህርት፣ በመደበኛና የመደበኛ ስራዎች መሳተፍ፣ ለፖለቲካልና የውሳኔ ሰጭነት ተሳትፎ እንዲሁም ለተለያዩ የእኩልነት መብቶች ጉልህ አስተዋጽኦ ያለውን አጀንዳ ወደፊት ስናራምድ ቆይተናል።
With financial support from the International Development Research Center and in collaboration with Ethiopia's Ministry of Women and Social Affairs and multiple sector ministries.
ዋና ጥናቶቹ ዓላማዎች እነዚህ የቤት ውስጥ ስራዎች፣ እንክብካቤዎች ወደ ገንዘብ በመተመን ለሀገር ኢኮኖሚ ያላቸውን አስተዋጽኦ በጉልህ ማሳየትና የፖሊሲ ውትወታዎችንም ወይም አድቮኬሲ ስራዎችን ለማሳለጥ ነው። ሁለተኛው ደግሞ በስራ ላይ ያለውን የስርዓተ ጾታ አካቶ ወይም ጀንደር ሚኒስትሪሚንግ ፖሊሲ ስትራቴጂ ከማይከፈልባቸው የቤት ውስጥ ስራዎችና እንክብካቤዎች እንዲሁም በተለያየ ሁኔታ ላይ ያሉ ሴቶችን መብትና ፍላጎት ከማካተት ኢንተርሴክሽናሊቲ አንጻር መቃኘት፣ መገምገም የሚሉትን ዋና ዋና ሐሳቦች ይዞ የተሰሩ ጥናቶች ናቸው።
The project set out to do something ambitious, to generate evidence, to measure unpaid care work, and to push the conversation into national policy spaces. The project was implemented over a 25-month period, including 22 months of active implementation and an additional 3-month no-cost extension. From the beginning, the initiative was designed as a national-level collaboration involving government institutions, civil society organizations, researchers, development partners, and policy experts. Key partners included the Ministry of Women and Social Affairs, the Ministry of Education, the Ministry of Health, the Ministry of Labor and Skills, the Ministry of Water and Energy, and other line ministries including the Ministry of Agriculture. international organizations, women's rights groups, research institutes, UN agencies, and civil society actors also became part of the broader collaboration.
ይህንን ስራ ደግሞ እንድንሰራ ያገዘንን አይዲአርሲን ይህን ስራ ስንሰራ ሴቶችና ማህበራዊ ጉዳይ ሚኒስቴር ባንድ ላይ በመፈራረም ከዛም ባለፈ ደግሞ በነበረን የተለያዩ ሂደቶች ጽናቱንም ስናካሂድ ሆነ በተለያየ መንገዱ ሲያግዙን አብረንም ስንሰራ ቆይተናል። የተለያዩ አካላቶች በዚህ ሂደት ውስጥ ባለፉት 2 ዓመት አብራችሁን የነበራችሁትንም እንዲሁ እውቅና መስጠት ፈልጋለን። ምክንያቱም ካልተባበረን እንዲህ አይነት ስራዎች በአንድ ድርጅት የሚሰሩ አይደሉምና አብረን ስለነበረን ጊዜ ማመስገን ፈልጋለሁ።
2 major studies became the foundation of the project. The first focused on implementation research, examining existing national and sectoral gender mainstreaming guidelines through the lens of unpaid care work and intersectionality. The study explored how unpaid domestic work affects women differently across regions, economic conditions, and social realities, particularly the differences between women in rural communities and those living in urban areas. The second study attempted something even more difficult, measuring the economic value of unpaid domestic work and its contribution to the national economy and gross domestic product. The research sought to answer a question rarely discussed in economic systems. If unpaid domestic work were counted, how much would it truly contribute to society? Over the next 2 years, the project evolved through research discussions, technical reviews, consultations, trainings, workshops, validation meetings, and national dialogues. The journey began with an inception workshop held in Nairobi, bringing together representatives from NEWA and the Ministry of Women and Social Affairs. This was followed by the official launching workshop on August 27, 2024, marking the formal beginning of the national initiative. Researchers, government institutions, civil society organizations, policy experts, development partners, and technical committees came together to examine a question that had long remained overlooked. Throughout the process, multiple technical committee meetings, inception meetings, validation workshops, and policy discussions were conducted to review findings and guide the direction of the research. Validation meetings were organized both at the technical committee level and with larger stakeholder groups, allowing experts, institutions, and community representatives to review methodologies, challenge assumptions, and approve findings before publication. A technical committee led by the Ministry of Women and Social Affairs was established to oversee the process. The committee was composed of representatives from government ministries, civil society organizations, research institutions, development partners, and technical experts. Its role was not only administrative. The committee closely followed the progress of the research, reviewing methodologies, monitoring implementation, validating findings, and ensuring that the studies reflected the realities women face across different communities. Researchers regularly presented findings, received feedback, revised methodologies, and validated results through multiple rounds of consultation. The process was not simply about producing reports. It was about building national recognition around unpaid care work. It was about moving the issue from private spaces into institutional and policy conversations. One of the project's most important findings revealed that unpaid care in domestic work is not simply a private household responsibility. It is a major, yet largely invisible pillar of Ethiopia's economy. The valuation research estimated that unpaid care in domestic work contributed between 16.8% and 22.6% of Ethiopia's 2022 gross domestic product, depending on the valuation method used. When measured through replacement cost methods, the estimated annual value exceeded 1 trillion Ethiopian birr, placing unpaid domestic work among the largest contributors to the national economy, despite being completely excluded from official economic accounts. The research also revealed a stark gender imbalance. women spend an average of 41 hours per week on unpaid domestic and care work, compared to 21 hours for men, limiting women's opportunities for paid employment, education, rest, and public participation. The findings showed that women carry a significantly larger share of this invisible labor, reflecting deeply rooted social norms where caregiving and domestic responsibilities are primarily viewed as women's duties. More importantly, the research challenged traditional economic systems that fail to recognize unpaid labor, emphasizing that households, communities, and the broader economy continue to depend on work that has long remained unseen, uncounted, and undervalued. The implementation research revealed that while many national institutions acknowledge the burden unpaid care and domestic workplaces on women and girls, meaningful action remains limited. Ministries such as the Ministry of Women and Social Affairs, Ministry of Health, Ministry of Education, Ministry of Labor and Skills, and Ministry of Water and Energy recognize that unpaid domestic work affects women's education, employment opportunities, health, and overall participation in society. However, the research found that unpaid care work is still not systematically addressed as a central policy issue. Existing guidelines often acknowledge gender inequality without providing clear strategies, institutional systems, or long-term interventions to reduce the burden women carry. The study also highlighted the absence of a strong intersectional approach, meaning the experiences of rural women, women with disabilities, economically disadvantaged communities, and other marginalized groups are not adequately reflected in policies or data systems. In addition, weak institutional structures, limited budgeting, low awareness, and insufficient coordination between stakeholders continue to slow progress. As a result, practical support systems, such as childcare services, flexible working conditions, and infrastructure investments that could reduce women's unpaid labor remain underdeveloped or entirely absent. At the center of many discussions was the 5R framework promoted by UN Women: recognize unpaid care work, reduce women's burden, redistribute responsibilities more equally, reward care through supportive systems, and ensure women are represented in decisions that affect their lives. The framework became a guiding lens for discussions around policy, gender equality, economic participation, and social protection systems. It also encouraged institutions to ask difficult but necessary questions. How can women's unpaid labor be recognized within national systems? How can public services help reduce the burden women carry every day? How can families and communities redistribute care responsibilities more fairly? And how can women become more represented in decisions that shape policies affecting their lives? Through months of research, consultation, validation workshops, and collaboration between institutions, the project generated evidence that helped make invisible labor visible. The findings were transformed into research reports, policy briefs, integrated publications, journal manuscripts, and practical training toolkits designed to support future policy and implementation efforts. Policy briefs were specifically prepared to help decision-makers and parliamentary representatives engage with the findings in simpler and more accessible ways. But the project was not only about producing documents, it was about creating conversations. The discussions expanded beyond research rooms. Trainings were conducted for government institutions, women's political party representatives, civil society organizations, technical experts, and sector ministries, introducing concepts such as unpaid care work, gender mainstreaming, and intersectionality. The project also supported broader public engagement through media outreach. A radio program titled She Has Work broadcast discussions and stories around unpaid domestic labor, helping bring a topic often hidden inside homes into public dialogue. As the project moved toward its final dissemination workshop in April 2026, the conversation around unpaid domestic work had already begun expanding into national spaces.
ይሄ ጥናት ላይ ተለይቶ የመጣው ጉዳይ ወደ ፖሊሲ እንዲመሄድ ከፖሊሲ በኋላ ደግሞ ወደ ህግ እንዲሄድ ከዛም አልፎ ደግሞ የራሱ ደንብ መመሪያ ስትራቴጂ እቅድ ኖሮ እንዲሰራና ዋጋ እንዲኖር ከማድረግ አኳያ እንግዲህ አሁን እንደተገለጸው ከጋይድላይኑም ጋር ከዚህ ከማይከፈል ቤት ውስጥ ስራም ጋር ተያይዞ የተጠና ጥናት አለ። ተለይቶ የመጣ ውጤት አለ። አሁን የውጤቱ ምርቃት ቀን ይሁን እንጂ ቀጣይ ደግሞ ጥናቱ ላይ የተቀመጡ ጉዳዮች ወደ ተግባር የሚቀየርበት ሁኔታ ላይ እኛም እንደ ህዝብ ተወካዮች ምክር ቤት እንደ ቋሚ ኮሚቴም የመጣን እንደ ሴቶች ኮከስም የመጣን ጥናቱን ወስደን ሁላችንም የበኩላችንን አስተዋጽኦ ማበርከት አለብን።
The final outputs were prepared for publication through the websites of NUA, the Ministry of Women and Social Affairs, and the International Development Research Center. And perhaps most importantly, the project helped create a foundation for future action.
በናሽናል ሌቭል ነው የሰራነው እንጂ ክልሎች ድረስ አልሄድንም። ስለዚህ ቀጣዩ ስቴፕ ባገኘነው አቅም መሰረት ወደ ክልሎችም ለመሄድ ነው ጥረት የምናደርገው። ሁለተኛ ደግሞ ወደ ሎካል ላንጉዌጅስ የመቀየር እነዚህ በጣም ጥሩ ማቴሪያሎች ናቸው። መለካቱ፣ ማስፈጸሚያ ስልት ማስቀመጡ፣ እንደገናም ደግሞ እንደ ጋይድ ለሚሰሩት የጀንደር ሜንስትሪሚንግ ማኑዋሎች እንደ አንድ ወጥ ስታንዳርድ መጻፉ ኢንተርሴክሽናሊቲን ይዞ አንፔድ ኬር ወርክን ይዞ መሰራቱ ስራ ላይ መዋል እንፈልጋለን።
With the active involvement of ministries, civil society organizations, technical experts, and development partners, the conversation around unpaid care work had begun moving from research into national ownership. The final outputs of the project were not intended to remain on shelves. They were designed to become tools for policy, advocacy, education, institutional reform, and long-term social change.